There's been a major breakthrough in chronic pain in a recent study, with the average percentage of 87.29% pain reduction within 5 to 10 minutes. Welcome to the Chronic Pain Academy, where science meets soul and healing becomes reality. Led by the compassionate expertise of Dr. Paul, here are the real recovery stories. Tune in to be inspired, educated, and empowered to take your healing into your own hands and finally reclaim your life.
Hi, I think we've made the breakthrough that we've been looking for in chronic pain, including fibromyalgia, CRPS, trigeminal neuralgia, and most of the neuropathies that's been going on for many, many years. And in the next few minutes, I promise you that you're going to know more about these conditions and how to alleviate them than almost any doctor in the world. Welcome to our Chronic Pain Relief Academy. I'm Dr. Paul. All of the things I'm going to tell you are the work that I've done and my beliefs. And so that would be, I guess my disclaimer is that this is my work. If I say something that looks like an outrageous claim, it's coming from my work and my studies and the things that we've done that prove what we've done. So as we're getting started, I'd like to ask you a question. What is the first thing you think of when you think of a hero? A lot of people might say, well, my mom was a great hero to me, or I have a friend, or the pastor of my church, or. But what if I submitted to you that a prisoner of war, agree with me that a prisoner of war is a hero? Number one, we don't have a draft. So this person that most people could we don't have a draft. And so these people volunteer for their position. And oftentimes when they do, they don't realize they're going to end up in war, but they know it's a possibility. And the next thing you know, they're in a war, and then they get captured. When they're taken, everybody knows that it's not an easy situation. It's very fearful. Oftentimes they torture them. They give them drugs to keep them from sleeping, or even drugs to make them hallucinate or have problems. They're given drugs they really don't want. They're set into situations where they're rejected by their peers. And rejection, they say, is the number one form of torture. And so this is always part of what they do, oftentimes even in isolation and oftentimes even years of that. They can't sleep, they're in pain, they're rejected, they're isolated. And I would submit to you that a chronic pain patient, especially a severe chronic pain patient like fibromyalgia, is very similar to a prisoner of war. Number one, they're taken prisoner by this without their consent. They're given drugs they really don't want to take, and these drugs oftentimes will make them foggy-minded. They can't think clearly. And torture, the pain is absolute torture. For those of you out there who suffer chronic pain, you know how torturous pain can be and how difficult it is for you to get through the day, with chronic pain and maybe it's some CRPS, and every step is painful. Or maybe it's a fibromyalgia, and you've got full body pain. But pain is one of the things that's extremely difficult to deal with, and oftentimes the pain is unbearable. And so this chronic pain patient is suffering in pain. They're oftentimes isolated, and people say, well, why would they be isolated? It was oftentimes when their friends come over, they're too sick to participate. They don't want to go anywhere. They don't want to do anything. Oftentimes, after a few minutes, they say, look, I've got to go back to bed. So most of them who are severely ill rarely have any real good companionship other than maybe their own family. So they're isolated. They're given drugs. They all come to a point, the prisoner of war and the chronic pain patient comes to a point where they have something that they have to deal with, and they go, do I really want to continue living like this? The answer is almost always no. And so then the next decision they make is, what am I going to do about it? So are they going to continue living with this, or do they take their life? For the prisoner of war, they look at it as Maybe someday I'll get rescued, we'll win this war, I'll be able to see my family again, and so they'll hang on. If it weren't for that, most of them would probably take their lives. For the chronic pain patient, they look at it as, I've got a family right here that loves me, I've got children. If I take my life, maybe one day my child will think that's the way we deal with problems and take their life. If I don't take my life, I'm confined to a lifetime of pain because most of these things they've been told are incurable. And so at the end of the prisoner of war, when they come back, they might get a parade, they get a lot of pats on the back, maybe medals for what they've been through. And for the chronic pain patient, they get nothing. Oftentimes, they've been rejected by their doctors, sometimes even their family, sometimes their spouses, and so they live with a future that looks bleak, and oftentimes they've been told it just gets worse with time, and most of the time it does. So I present to you that a fibromyalgia, RSD patient and some of these other chronic pain patients are very much like prisoners of war and suffer like prisoners of war, but they don't have the accolades that you would get as a prisoner of war that a person, as they have fibromyalgia suffers. So it's absolutely phenomenal what these people go through, and I don't know how to say enough about that and how to give them enough. So here's my thing. When I asked you in the beginning, what is a hero? I think that these chronic pain patients are heroes. They are heroes. If you're out there listening to this and you're suffering with this, you are a true hero. You are suffering just like a prisoner of war and deserve a pat on the back just like a prisoner of war, because this is an amazing thing that you're going through and quite a journey. And some people say, well, why have I been in a position where I have to suffer this? Those are really questions that are almost spiritual questions, and sometimes we don't really have the true answers and know what's going on. But I'll tell you this, I spent years in bed with fibromyalgia. It was the longest days. People say time goes by fast, not when you're really sick with this. And so after spending years like that, with the days just dragging on and the nights, without sleep at night, it's 4:30 in the morning, you still haven't gotten to sleep. And I remember one night I woke up and it was 4:30 in the morning and I fell asleep. And then I woke up again, I go, oh, that was great. I got a couple hours sleep. And I looked at the clock and it had been 5 minutes and my heart just sank. And that was kind of like a nightly thing. So as the days dragged on with this, and the people who were sick with it, they understand. And the people who are taking, the Ambien to sleep, and they're taking the fentanyl patches and the Dilaudid for their pain, and they're taking the Xanax for the anxiety. You know what? Don't scold these people or look at them like drug addicts, because a lot of them would not even be alive if it weren't for those medications to help them. So I have, what if I told you that I've developed a technique that relieves most people's pain in 3 to 5 minutes? Is that something you'd be willing to learn? Would that be something you're interested in? We have a program, and this may seem really bizarre, and I think we're the only people in the world that do it. The new protocols that I've developed recently, because the previous protocols were all manipulative and they were being taught to medical doctors and chiropractors, and we have hundreds of people we've taught. But recently I worked on new protocols, and the protocols are pressure techniques that work better than the manipulation. And we actually can have a really sick person, because the sick people came in to visit me, and we were seeing 165 visits of people a day with the doctors helping. And these people were, you can't trick a bunch of people that all know each other. If they're not getting well, they'd all just get up and go home. And so we were having wonderful results, and some of our results were like 85% symptom-free in a couple months that were stable, not just with the first test. The first test, we can usually do that on the first day, but to get it stable is another thing also. So here's what, I'm almost hesitant to talk about this because it's so bizarre and it's so out there. When when a person would come see me, they'd have to fly in, rent a car, rent a hotel. They were there for 2 or 3 months, and it would be expensive by the time I got paid, and I was the cheap part of it. But the more expensive part was the hotels and the cars and the travel and being away from the family. The new protocols that we've developed, we are able now to train your spouse in these protocols and send the spouse home to get you well so you don't have to make that trip. You don't have to be away from your home and your bed and your couch or whatever it is that you're comfortable in. You know, and I say that to people who are mainly really, really sick, disabled people, but this can be a light case. You can have a light case of CRPS or trigeminal neuralgia or fibromyalgia or neuropathy. You can have light cases or you can have severe cases. A light case, a lot of the things I said you don't completely relate to because it's a light case, but oftentimes those light cases become severe cases. So what we're doing now, instead of having an office and having people fly in and stay and spend a fortune, we can train a loved one. It's better if you come with them so we can take a look at you, make an evaluation, get them on the right footing, and then we train your loved one and send them home to take care of you, and it saves you a fortune and a lot of effort. And so that's what we're doing right now, and I'm really, really excited about that. We've just now started that because of the new protocols, and so really, really excited about what's happening there. So for the first time ever, we have a test that alleviates most chronic pain, and I don't care if it's fibromyalgia, CRPS, trigeminal neuralgia, or different types of neuropathies. And as I say this is my belief, this is what I see, this is what we've been doing. I don't want to make an outrageous claim, but I just tell you what I've been seeing. And we see our last study we did on 35 people that we tested randomly at a health convention, we had 87.29% symptom-free in the first 5 to 10 minutes on their first visit at the convention. And that's pretty consistent with what we see everywhere. So we have this test, and the test actually alleviates the pain, and I'll tell you how that works and why in just a minute. And then we send them home, but we know at the end of the test that it's worked, and we know you're going to get well before you undergo care. So the test tells us if you're going to get well, and then how long that test lasts tells us how frequently to see you. And so when you come back, we can set up a frequency of care, and then how you respond to that care will tell us how long that goes on. So I think that this is one of the most miraculous things, because how many doctors have you been to so far with your chronic pain that took away your pain on your first visit and could tell you ahead of time whether you're going to get well or not? I would say none of them ever. And so this is a major breakthrough for us. We don't even charge for the first visit when you come in and get tested, because if it doesn't work, we don't want to take money away from somebody it doesn't work. But it works almost every time. I would say that it works. I don't want to give percentages because I get in trouble for that, but I'm telling you that it almost always works. So today we're going to learn a new word. And we're going to learn about what causes these symptoms, and we're going to learn about how we get rid of them. And I'll share that with you. Meningeal compression is the new word that I want to talk about. And when we talk about meningeal compression, it is, let's look at it like this. You've got your brain sets up above, and the spinal cord comes off of your brain, and then the nerves come off of the spinal cord that feed your whole body. So you've got 24 different levels of vertebrae, with nerves coming off above and below each one. So you've got like 25 pair that come off of the vertebrae alone. Plus you got your sacral nerves, your cranial nerves, your autonomic nerves. All of those have to pass through something that's called the meninges. The meninges is like a bag. This is kind of like a plastic bag that surrounds your brain and your spinal cord, but it's made in 3 layers. This is where your cerebral spinal fluid is. That's the fluid that when they pull this fluid off of your spinal canal in the spinal cord area, they pull this fluid off. That's what they pull off to see if you have meningitis or MS and a number of other things. But the outer layer of the meninges is so strong, you can hang from it. It doesn't stretch. It's very strong. And there's an encroachment. There's something that we've missed for many, many years, and something that actually the people who do manipulation have been taught to make it worse in almost every case. And there's pressure that's put on the meninges that pulls it out of its normal position and starts pulling on nerve roots. If you've ever hit your crazy bone, you can feel the pain and the tingling and numbness it creates in your 2 little fingers. That's your ulnar nerve, is your crazy bone. It's in your elbow. If you just rub it, you can actually feel it in your fingers just with very light pressure. The same thing, if you pull on nerves that coming off the spinal cord, it'll send signals to your brain from whatever area that goes to that gives you symptoms in that area. For instance, in the ulnar nerve, nothing happened to these fingers. It happened here, and it went from your ulnar nerve at your elbow to your brain, told your brain that your fingers hurt or your fingers were tingling when they weren't. There was nothing happening there at all. Your fingers, nothing happened. The same thing. Let's use a fibromyalgia patient because it's real classic and it's easier to explain. You pull on the meninges, you pull out of its normal position, and it pulls on large groups of nerves all at one time. If you pull on enough nerves at one time, it overstimulates the central nervous system, and if you've been following up with what science is finding, they're finding that you have a hyperactive central nervous system. Well, you have a hyperactive central nervous system because the nerves are being pulled on and they're firing and sending impulses to the brain that shouldn't be going there. So what is the brain getting? Well, if you pull, let's say it's an early case, which normally starts with the neck and upper limbs. So now you might have, your hands might be hot or cold or tingling or burning. They might be in massive pain. You could have pain in both arms and your neck and your upper back, and your upper back's in spasm. All of these things are coming because of the pulling on the meninges, and the meninges pulling on the nerve roots. What does that create? Widespread pain. Widespread pain. In Correlative Neural Anatomy, which is a standard neurology book for all medical doctors, chiropractors, and anybody who's studying the nervous system, it states that a patient who comes in with their hand, with pain in their entire hand, and they call that stocking glove neuralgia, the diagnosis for that is hysteria. And this is why so many times when people with widespread pain go in to get help, they get looked at as somebody who's looking for drugs, or they get referred to a psychiatrist because the doctor studied this in school and he was told that this is hysteria and this is a hysterical patient. Who wants to sit and talk for half an hour to an hysterical patient? But the doctor was wrong. And he was wrong because he didn't step away from his computer and go over and take a look at the patient and break it down and start studying it and figuring out what was causing this. And there's been a few doctors that did, and we'll talk about that in a little bit too. So you've got this widespread pain, and you've got this widespread symptoms of numbness or tingling or burning or pain, and all of these impulses hitting your brain at one time cause you to go into sympathetic. There's an automatic nervous system in your body that runs automatically, and it's called autonomic nervous system. It's coming from automatic, and it runs by itself. It has two functions, main two functions. One is parasympathetic, and that's what runs all day in all of us who are well, and that that makes it easy to go to sleep because you sleep in parasympathetic. It makes it easy for you to eat food because you eat in parasympathetic. You have sex in parasympathetic. That's why people who are nervous don't do well with sex. And the parasympathetic is the relaxing, soothing, feelings that you get when you're with a loved one and so forth. The sympathetic, when you're sitting in a room and a mad pit bull comes in, everybody automatically goes into sympathetic. They don't have to think about I'm going into sympathetic. It automatically takes place as part of the brain's function. And in sympathetic, you're either going to have to fight that dog or that lion or that snake or whatever it is that scared you, or you're going to run away. And that's why they call it the fight or flight syndrome, is because it's sympathetic. So in the sympathetic system, think about this for a second. If you pull in enough nerves because of this meningeal compression, that it will put you in sympathetic. Enough nerves hits the brain so hard, it puts it in shock, you go into sympathetic, and you live there. These people with fibromyalgia, to any degree at all, they live in some degree of sympathetic, and sometimes it's unbearable. The anxiety attacks, and the horrible anxiety actually is described as, in the dictionary, as a feeling of forthcoming destruction. Plus, you know what it feels like if you've been scared before. But they describe it as a feeling of forthcoming destruction. Now, how in the world can people live feeling like that all day, every day? And no wonder they take Xanax or other of your benzodiazepines. It's because they're miserable, they're scared, they're feeling like life's coming apart on them. So let's take a look at something. You're in sympathetic nervous system. Your sympathetic nervous system is running. You're in sympathetic 24 hours a day because of this compression and all the nerves that are firing. What systems of the body do you not need in sympathetic? What systems that function do you not need when you're in sympathetic? You don't need sleep because you're fighting and running. Maybe your blood pressure is up. So that's why so many of these people have high blood pressure problems with this, because you need that extra blood pressure. You don't need to eat, and you don't need to reproduce. None of those things are really important at all when you're in sympathetic. So now that you're living in sympathetic, you don't sleep. Your food doesn't digest properly. Almost all people with this to any degree have irritable bowel syndrome. And your reproductive system shuts down. So the test that we ran on so many people that came through showed horribly low levels of testosterone, because they don't need testosterone when they're living in sympathetic. So now you have someone who doesn't sleep. So what happens when you don't sleep? Everybody knows how hard that is. You are miserable. And if you do take medications to sleep, you still don't get into REM sleep, so you're still miserable, although it's a heck of a lot better than not sleeping at all. The anxiety oftentimes leads to an addiction to benzodiazepines, which are maybe worse to be addicted to than heroin. It's absolutely horrible. I think your benzodiazepines are one of the only medications you actually die a few days after stopping if you try to cold turkey them. They're absolutely horrible, and usually within the second or third day, you're in the hospital falling apart, because it's just. But for these people, it's almost the only way for them to live. So you've got that. You've got the benzodiazepines to help with the anxiety. Then now you've got problems with your bowels. Leaky gut syndrome is something that is normally associated. Now, this is somewhat controversial. Most people in the holistic profession are leaning this way, as well as the medical profession, is that enough leaky gut syndrome, enough of your your sympathetic running that leads to irritable bowel syndrome will lead to leaky gut syndrome. Leaky gut syndrome, the theory is, and I think it's being proven now, leaky gut syndrome leads to autonomic diseases. So you get particles coming through that are too big, and the body will attack them because they're not supposed to be in your bloodstream. Attacking those particles, oftentimes those particles look like the same thing that a joint's formed from, or your blood vessels are formed from. So it will actually attack your blood vessels. If it attacks your blood vessels, they call it disseminated lupus erythematosus, or shortly known as lupus. If it attacks your joints, it's called rheumatoid arthritis. And then there's other things too. And if you happen to be someone who's suffering from fibromyalgia, you also know that you're allergic to just about everything. You don't like the smell of detergent in the detergent aisle. You don't like candle shops. All the artificial things you put in your house to make it smell good. I know people that are so sick that if they come in contact with someone in cologne, it puts them in bed for 3 days. And this is because your body is not reading everything like it should. So it'll see something like a cologne as a danger and just go into a massive, reaction. In the same way as an asthma patient will have an innocuous pollen that they breathe in and go into a full-blown asthma attack where they swell up so badly they can choke to death. It's the same thing here. Because those nerves are not firing properly back and forth between the brain and the body, the brain is perceiving something that's not really happening, and oftentimes goes into, this emergency mode of allergic reactions or like I say, autoimmune diseases, allergies, that type of thing. So that's basically the how this whole thing works, and obviously there's a lot more to it, but so the basis is this, and let's just recap this. As a fibromyalgia patient, then we'll talk about something else. As a fibromyalgia patient, you pull on the meninges, you get widespread pain. You pull on it hard enough, it'll pull on all the nerves all the way down to your low back, and you'll have full body pain. I've seen many people with full body pain that they would rate on a scale of 0 to 10, 10 being unbearable pain, as a 10. I've even had people come in and saying it was a 15. I've had patients coming in that if I touched their shoulders, they would scream just from a touch. And so that is how severe this can be. This is why they feel like that. And if you're a person that's been suffering with this, this is why you feel like this. Our breakthrough is we can, with some simple pressure techniques, alleviate that pain by decompressing this area and releasing the meninges with just the pressure technique, and the pain is usually alleviated on the first visit to a great degree, if not completely. And so that's what we're dealing with right now. I had a friend, I don't know if I should mention his name or not, but he's a neurosurgeon, and he found the same thing I did. And for that, he lost his license 5 times. I mean, you don't make findings like this without being attacked, and I've been attacked too. So what he found was that this space up there, he looked at it as the space was too small. We looked at it as there's an encroachment due to movement, and we can reverse that without surgery. In his case, he was doing surgery and removing the back of the vertebrae from 1 to 3 vertebrae, sometimes more, in the upper neck, and he would take the pressure off of the meninges by doing so, and when he did, the patients would get well. He was mainly seeing fibromyalgia patients, but it would get well. And so, great guy. We ended up being good phone buddies, and a really, really neat guy. I actually know another neurosurgeon that he did surgery on that had fibromyalgia as well also. So there is some good stuff out there, and some other doctors that are looking at this. He just retired recently, so that was a real severe blow to the profession. So what we're doing is we are able to give you your power back. We give you your sleep back. We turn the sympathetic nervous system off. We don't actually do it. Actually, the body does it when it's all we're doing is opening this up and letting it go back to normal without manipulation, without surgery, without needles, with none of that. And it's something, like I say again, that we can teach a sick person's spouse to do so they can go take care of them for a lifetime. With my patients that came in, we would see them for 2 or 3 months with the manipulation. That's before we developed this. Now, by the way, the pressure techniques works much better than the manipulation. I hate to say that, but that's exactly the way it is, and I'm happy about that. Then they would go home. Sometimes they would go home and get sick again or have some problems. If you've got someone who's there that's been trained, they can take care of you and deal with those problems, and we're always available for support. So we don't have that. Now, we did do a study. Somebody wrote on the internet that all of our patients went home and got sick again. So we called them all, and we wrote them all and had them fill out surveys and took surveys over the phone. The 2 surveys, from the phone and the written surveys turned out the same, that we were losing an average of 6% of their correction after they went home, which I was sad that they were losing anything, but for people that were going home and not getting care, I thought it was pretty phenomenal. But now, with the new way of actually taking a loved one and training them to take care of you, that's not necessary to lose anything whatsoever. So we're giving your power back, your sleep back. We give your health back. We give you options back. At this point, if you're you're the person that's sick, you go home, you go to work, you go out and play, you go on vacations again, you do those type of things. Now, on the other hand, if you're the person who is the caregiver, whether it be a loved one, whether it be a chiropractor, a medical doctor, a naturopath, or a massage therapist, or anybody who can use these techniques, you're giving people their lives back. You are saving lives. And people say, well, that sounds like an exaggeration. This is not an exaggeration at all. I had 3 people in 2 months take their lives, their own lives, that already had appointments in my office because they just gave up. Now, what does that mean? That's called failed hope syndrome. If you go to enough places and you spend enough money, after all, you just feel like it's impossible. They're all lying. There is no way for me to get well. And oftentimes, these are the people that take their lives. And if you're going to learn this as a practitioner, as a doctor, you are going to be helping people that would have taken their lives. You're going to save lives. I trained, oh my goodness, I don't know, somewhere 1,300, 1,400 physicians and doctors. How many tens of thousands of people are well now that wouldn't have been well otherwise? How many lives have been saved? If you want to participate and learn this, I'm so excited about that, because we need help desperately in getting this out. Do you realize and look it up on the internet, there's over 50 million chronic pain sufferers in this country. Documented chronic pain sufferers in this country, over 50 million. Do you have any idea how many people would need to be trained to take care of 50 million people? I could train 1,000 people a week and never catch up with that, plus all the new ones that are coming in all the time. We need help. We need help in people to learn this and to help these people get well. And if you're bored with your practice and you're a medical doctor or a chiropractor or a massage therapist, a dentist, you could put this in a dental office. You can expand and help people get well that never had hope before. You can give them hope again. And when they come in on the first visit and you work on them and you take their pain away, that is amazing. It's probably the first time ever they've had any relief. They go home and tell their spouse, you won't believe what just happened. That's powerful. And that's powerful. And you're going to see so many people like this that are so thankful. So, I'm asking you guys out there, stand shoulder to shoulder with me. Learn these techniques. Get out there and get people well. Tell other people about it so they can get well too. This is a girl. I don't have the best lighting on this one, but it was just so precious, and it was that I wanted you to see, her take on it. This is a very short film, and I think one of the things I want you to take away from this is that a lot of people out there that look like they are mentally challenged, Maybe you look like a street person, or you're talking to somebody who's on the street that looks really bad and looks a little crazy. That's a bad word to use, but you know what I'm talking about. Maybe they're not. Maybe they're just sick. Maybe they got on the street because they're too sick to take care of themselves. Here's a good example of that.
I am having trouble speaking, and hopefully the doctor will be able to adjust me like before and bring back my ability to talk. I couldn't walk or talk. I couldn't sleep. I couldn't write my name. And it's going to be hard to get through this. 2 years I spent like that. My life was over. I prayed for death every day.
You can see the difference between, this is the same person, by the way, in case you didn't pick up on that. This is a wonderful, loving, powerful woman. She's a powerful woman, but you can see what this meningeal compression can do to you if it pulls on enough nerves, and it can affect things. Now, we have quite a few people that couldn't speak that got their speech back when we worked on them. We have people that get their hearing back. I've had 2 people who were blind that got their sight back. I'm not claiming to cure blindness. I'm not claiming to cure I'm not claiming to cure anything. All I'm saying is when we relieve the pressure and allow the brain to talk to the body, people go back to normal. And then they get well, and they go home, and they're happy, and they work again, and they go on vacations again. And that's what we're working for, and that's why I'm pleading with people out there. Anybody has an inclination, please learn this. Help other people. And for those of you who have a loved one at home, that's sick, learn this. Get them well. It's a whole lot cheaper to learn the technique than it is to go to bring them into the office and get them out of their normal environment and spend a fortune on hotels and things. So we're so happy we're able to do that now. Anyway, this is such a darling woman. So these people suffer like prisoners of war. And somehow, without honor, these giants of humanity, and I believe that totally, these giants of humanity who have maybe somehow been counted worthy to suffer, they go on unnoticed year after year, and oftentimes looked at as if there's some type of a sub-level of humanity, and it's not good at all. And so it has been my honor to suffer. I'll tell you, it was a hard time to go through this, a really hard time to go through this, but it was the best thing ever, because out of that, it helped get me to understand what people were suffering with, and then how to develop this so people can get well. And so I hope this information will change your life, and we have so much more to cover. And again, if you're sick, get well. And for people who are sick, even the Bible talks about people who suffer, get out and help other people who are suffering. And that's really what's going on. Now, you might say, well, this sounds like a whole big deal, but I have some of those symptoms, but I don't have all of them. That's called a light case. A light case can just have symptoms like, maybe it's the person at work who likes to have their shoulders rubbed. They don't sleep well. You don't know it, but they take, an anti-anxiety, and they in addition to that, they take sleeping pills to get to sleep. And they don't even think it's any big deal. They just think they have an anxiety disorder, and they have insomnia. But the anxiety disorder creates the insomnia, and the anxiety disorder is a physical thing almost always. It's not a mental thing. Now, I'm not saying people can't be hurt when they're children and lay awake at night, thinking about their problems or even have anxiety from it, but I'm talking about the vast majority of people who are suffering like this. When we test them, that anxiety drops immediately, and we know where it's coming from then. And so they can, a light case of this can be helped also. So you got a light case, just, come in and get trained yourself. Get well. Go out and help other people. And then there's the people who've been sitting at home for the last decade or two, just in absolute misery. Think about this. You're living in your home in misery, on heavy medications. You're a little out of touch with reality. So when these people get well, we have them get back in society a little bit at a time because it's a big shock. It's like going into a whole nother reality. So just the National Institute of Health, their diagnosis, the National Institute of Health, they characterized fibromyalgia as chronic widespread pain, unrefreshing sleep, anxiety, depression, physical exhaustion, cognitive difficulties. And they were saying it's in the population of somewhere between 2 and 4%. I think it's actually quite higher than that because we see so many people that come in with these symptoms that have never been diagnosed. I want to tell you a little bit. We're going to talk about CRPS and trigeminal neuralgia and your neuropathies here in a minute. But I want to tell you a little bit about how this got started. I was first working on this, and there was a genius doctor who, instead of just saying these are all crazy people and referring them to a psychiatrist, he actually got his hands on his patients, which is amazing to me that more doctors don't do that. And he found that they had scar tissue. Almost all these patients with this group of symptoms had scar tissue in their upper back. And so he coined the name fibro. Fibro means like fibrous tissue, scar tissue. Myo is muscles, and algia is pain. So he called it fibromyalgia. He coined the name. Brilliant move. It helped so many people. Millions of fibromyalgia patients are out there going, maybe somebody understands me. But still at that point, most of the doctors were looking at these patients as if they were mentally ill. I used to do a lot of climbing, and I was up rock climbing in Donner Pass up in Northern California. And there was a guy climbing on a route next to me. We climbed with ropes and stuff. And he said, "Hey, you're that fibromyalgia doctor, aren't you?" And I go, "Yeah, I am." And he said, I work emergency over here at such and such a hospital in Reno. And he said, fibromyalgia patients are just fat middle-aged women that need attention. I was so shocked. I couldn't even think of anything to say. I couldn't believe it. Anybody could be so cruel. This is the guy when you're just in massive pain, you end up in the emergency room. This is the guy you meet. It was horrible. So this first doctor, he finds this, and then somebody else comes along and goes, well, I found these tender spots. And these patients will have tender spots in like 18 different areas that are common between all of these patients, or most of them that have these symptoms. And so he said, well, if you have 12 out of these 18, I don't know where he got 12, but it was a good start. He said, you have 12 out of these 18, you have fibromyalgia, and that's a new diagnostic protocol for fibromyalgia. And I'm like, okay. And then somebody else comes along, and that was miraculous. It was miraculous. Another guy got his hands on people, and it was a medical doctor too. And so we're so proud of this guy. And so then from there, it went on into, we think it's a combination of toxins, a combination of trauma, and stress. And you put all those things together, and you end up with fibromyalgia. And so, okay, so I'm thinking about that, and I'm thinking, well, this is like, how in the world are we ever going to figure it out when we have three things that are all, not coinciding with each other? So I started thinking about that, and it turns out that it becomes almost impossible to figure out when you have that many things going on. So I said, I've had a lot of patients that had these symptoms after car accidents. I'd seen a lot of car accidents. So what do you say we throw out stress and toxins and deal with it as trauma? And so from there, I was able to say, well, a lot of these patients are having full body pain. You can't have full body pain unless it's, it's coming from the nervous system, and it's coming from the nervous system, unless you had some kind of a systemic disease. And so looking at it neurologically, it'd have to be coming up above the brachial plexus. And that's how I got going down that path and ultimately ended up figuring out that it was coming from the meninges after going down some other paths that didn't work out. And so that's how we originally found this in 2002, or I found it. And so again, this is all my work. And I say that it's all my work not to brag, but to say that these are my beliefs and this is what I've found and I believe, and I don't want to make any claims that are going to get myself or anybody else who's doing this in trouble. So the other thing that was happening to these patients is they were being institutionalized, especially in the 1800s and early 1900s. These people were considered hypochondriacs and oftentimes just crazy and institutionalized. By the way, today, I think a lot of the people in institutions and a lot of people in the streets and a lot of alcoholics and a lot of people that are called drug addicts are just sick people that are so sick they end up on the street or in an institution or with a label like an addict and living in the street when they're just sick people. I was fortunate enough that my company, my previous company, where we were training with the manipulation, we got some notoriety, and you can see that when Joan London did a special on my company. We ended up on Fox News and WebMD and CNN and Forbes and Discovery Channel, a lot of different places, and so I'm really, really happy that we got that. But with all that, I'll bet you anything that you haven't heard about it. And because it just takes a lot to get this out. Now, so right now I'm traveling around doing seminars in different places, and this is a psychiatrist that took my seminar, and I'll let you see what he has to say about this.
Well, this treatment was amazing, and it's amazing to see people who are hurting, who are suffering chronically for years, and they get a breakthrough. You see people in chronic pain, acute pain, suffering, and all of a sudden it's turned off. As a physician of 50 years, that's rarely seen in any kind of condition, any kind of situation. So this is highly recommended. It's highly recommended for those suffering, those that have given up. As a psychiatrist, this is an excellent treatment for those that are actually thinking about giving up their lives, because there's relief is available. So we really recommend this doctor, his treatment, his methods, and I give my 100% endorsement. Amen.
Hey, I'm Dr. Michael Johnson. I've been in functional medicine and functional neurology since 1983. Has an incredible seminar program. It's the Neuromatrix program. I've been here out in Salt Lake City with him this weekend, and it's been great. I highly recommend it.
So there's a couple people who had taken the seminar, what they had to say about it. What we do at our trainings, I don't know what they call it, seminar training. What we do is we'll train like all day long on Saturday until we get through the information real well. Then we're doing, hands-on, and I'm giving you information about how to manage your practice and practice building and all of those things. And then Sunday morning we'll go again and go over everything, give you all the information, all the paperwork and everything you need to start a practice. And then in the afternoon, I have the practitioners bring their sickest people in. So now all of a sudden we've got people coming in they've been working on for a long time that they couldn't get well and are still suffering. And then we let them work on their own patients and see, or their own clients, and they can see themselves that they can do it and that it works real well on people they couldn't help before. And so that becomes really, really powerful. I have a woman who came in to see me years ago in Southern California, and she tripped over the forks of a forklift at Home Depot. I believe it was Home Depot, one of those places. And she, I don't want to make Home Depot look bad because they're a wonderful company. Anyway, she tripped over the forklift, and it wasn't their fault, and she fell, and she ended up hurt and in really bad shape, and she came in to see me, and I just really didn't do that well of a job, or that good of a job getting her well. And then 13 years later, she comes up to see me again when I was practicing in Northern California. And at that point, she was in this shape and unable to speak, barely able to function, in massive pain, can't climb stairs. And I'll let you see what she has to say right here. And this is, I think you're going to enjoy this.
This fibro since 9/4. Joanne Foster Brownyard. I've been here for 8 days. Find it healing pressure. I was able to sit up. I was able to talk. I could not talk before. And I have no pain. I feel fantastic.
Again, here's a really good example of somebody you might meet and discount as a person because of the situation they're in. But look at her 8 days later. I mean, she's climbing stairs. She's going out dancing. She was wonderful. I actually called and talked to them recently, and she's still doing well. And I'm really happy to have known her. What a great woman. I'm going to wrap up fibromyalgia for right now. I did write a book on fibromyalgia, and actually, I'm not even, you can get it on Amazon, but I'm not really selling it right now. My main thing is I use the book to give people to take the training so that they can use that as a basis to get their own books going. I want to show you something else. I think you're going to get just I think you get some joy out of this one. I won't say any more.
My name is Kari States. I'm from Modesto, California, and I've had fibromyalgia for 11 years.
Can you tell me, can you show me your arm? And what the problem you're having with your arm? Can you show me what happens if you take the weight off? Are you doing that, Kari?
No.
You're not doing that at all?
No.
That's what it does by itself?
Yes, for 4 days. In that time, my pain level has been cut by about half. My arm has slowed down a lot. It used to be like a bird who was a flying bird, and I don't have to worry weight anymore. And I'm looking forward to...
That's Kari. What a dear. She had been... she'd spent her life at Stanford and UCSF. Nobody knew what was causing it or why her arm flapped like that. I've talked to a lot of neurologists, and they don't know why her arm flaps like that. It's pretty amazing that happened. And if you can imagine being a little girl trying to go to school like that, bless her heart, the little girl played in the band. And I don't know how in the world she did it like that, but she did. And anyway, sweet, sweet girl. They wanted to cut muscles, cut nerves, give her medication, injections. Her family refused, and then fortunately, her dad refused to let her come see me, and her mom said, "I don't care what you're saying. I'm gonna take her in," because they'd gone to one of my seminars, and I'd worked on her at seminar and helped her. Anyway, she's still alive and well, and she just got her degree. She has a doctorate in divinity, which I was really happy to see. So again, a recent study we did with 35 people, we're on the first visit, we're usually with all chronic pain, 87.29% symptom-free in 5 to 10 minutes. And that's on the first day, and that's one study we did, but we're finding pretty consistently with that everywhere we go. So I want to talk a little bit about CRPS. There's a lot of you out there probably waiting, how come he's spending so much time on this other stuff? CRPS is chronic regional pain syndrome. Chronic regional pain syndrome used to be called RSD, reflex sympathetic dystrophy, but the name was so weird that they finally changed it to something that actually made more sense. And so CRPS looks like this. You'll have an ankle injury or a knee injury, maybe even a surgery on it. After the surgery, the doctor comes out, he's happy, he did a good job, but your knee pain is worse. Your ankle pain is worse. Maybe it wasn't even a surgery, you just had an injury and it just keeps getting worse and worse. This is a really, really severe problem. They also call CRPS a suicide disease because it hurts so badly that many people take their lives. They just can't bear the pain and can't bear to live like that. So the doctor reevaluates and he goes, I'm a good doctor. I have success all the time with knees or ankles or wherever it happens to be. So he said, I did a good job. And so he looks at him and gives him some time. Let's give it some time. Let's take some anti-inflammatories. Let's do this. Let's do that. Give some medication for it because it's so severe. And then finally the patient goes, look, I just can't stand it anymore. You got to go back in there and look and see what's going on. He said, well, maybe we have some scar tissue or whatever. So the doctor does another surgery. This time when they come out, it's much worse than it was before. And now, you know, the patient is going, what in the world, this crazy doctor, he's just wrecking my life. And the doctor is going, what's happening? What did I do wrong? Now the doctor is not sleeping at night, laying awake at night. I mean, I can't tell you how many nights I laid awake trying to figure out all of these things through the years as we've progressed with our treatment, trying to figure out what to do with different things. And so doctors, I think most doctors really do care, and they really want to do a good job. You don't take all that training and work that hard just to take advantage of people and be mean to people. Now, I'm not saying that some don't, but predominantly that's not the case. So now the doctor goes back in and does another surgery maybe, and it still get worse. And this patient is just losing their mind. What we have found, and this is the part that I don't fully understand, and I'll just tell you what I know and what I don't know, but I don't know how a meningeal compression can create fibromyalgia in one person and CRPS in another person. And the CRPS oftentimes will spread. It may start with the knee, and then it goes into the whole leg. Maybe it goes into both legs. And so it spreads and becomes more like a fibromyalgia. But primarily, it stays in one place. So here's my hypothesis on that, is that pain is cycling for some reason, and probably, you know, when they did the surgery, the pressure that was placed upon the neck with them lying like that flaccid for so long could have caused those structures to encroach upon the meninges. And in this case, instead of creating more of a fibromyalgia, it cycles pain. And it'll cycle that knee pain, and that knee will hurt when you touch it. It'll swell up. It'll turn red. It looks so real. And when we take the pressure off of the meninges, the pain goes away. I had a woman that came in from Colorado, and she came in to take my training in Southern California, and she had CRPS, and she just spent $100,000 in a clinic, being there for 4 months, spending $25,000 a month, and they brought her pain level from a 9 to a 7.5. We worked on her for 5 minutes, and her pain was gone completely. She got up, took her boot off, and ran up and down the hallway. And this is the kind of thing we're seeing on a regular basis. And there's no way for me to hide that from you, because if you come take the training, you'll see it for yourself. But this is what we're doing, and this is why I'm so excited about it, and this is why I'm asking you to shoulder to shoulder with me. Let's get together and get out and get people well, help people get well, get the word out, let people know who are sick that they can get well. They can send a loved one in to get trained and come home and take care of them. I mean, this is like, it's such a big breakthrough for us, and there's so much to be learned. I mean, I'd like to tell you why this compression will cycle pain in one patient and create fibromyalgia in another patient. There's so much that needs to be learned. You know, I have a theory that might even be causing cerebral spinal fluid flow and creating dead spots. It creates plaques. It creates MS, but I don't know. And the research on that would be so extensive and take so long. I just don't know. Or neuropathies. I spent 2 days working in a diabetic neuropathy clinic. And I tested the people. Everybody came in, I tested. And what I found is that half the people that were diagnosed with diabetic neuropathy didn't have diabetic neuropathy. They had a meningeal compression. And when I tested them, their neuropathy went away. The other ones had diabetic neuropathy, and it didn't go away, and it couldn't help it at all. So if I'm trying to say that I can help all chronic pain, no, that's not what I'm saying at all. What I'm saying is that most of the chronic pain we can help, most of the neuropathies we can help, and we have found a way to do that that's absolutely miraculous, I think. And we do it on the first visit. If you come in and get tested and it doesn't work for you, and I encourage all the people I train to test for free on the first visit. If it doesn't work for you, then they don't charge you anything, and don't start treatment because it's probably not going to work. We don't treat people that it doesn't work, the test doesn't work. So when you come in and you get tested, if the pain goes away, we know we can help you before we start care. Now, is that 100%? No, it's not. It's not 100%. I had one guy that came in, he was a young guy, 28, and I could hold it, the pain would go away, but he couldn't hold it because he had such severe car accident that ripped the ligaments loose, and the ligaments couldn't hold what we were doing. And so there are exceptions to it. And if we get into it and it's not working, I advise all my practitioners, don't keep treating somebody that's not getting well, because it's not fair to take their money. Or if you want to treat them, don't charge them, if they're not responding, and see if you can help them anyway, or find them help somewhere else. This is not a good thing to take people's money, that don't get well. It's just not fair. I did a study with 70 patients early on when we were doing manipulation, and in 2 months, this was a 300-page study, and in 8 weeks, we reduced the symptoms by about 71%, and the intensity of the symptoms also. This is a study. I can send you the study without the patients' names on it. If you ever want to look at it, it's pretty interesting. One of the problems with the study is it included everything that ever went wrong with you, and so it hurt our stats a little bit. And later I did another study off of we take reports every weekly. You fill out a form, and these forms actually will, are more gauged towards meningeal compression type symptoms like nervousness, irritability, depression, fatigue, irritable bowel syndrome, widespread pain, those kind of things. And with this study, it jumped our results up to 85%. So we actually had an 85% symptom free in a couple of months with manipulations. And I don't have enough studies with the new protocols with the pressure techniques, but it appears that the new techniques are working way, way better than the old techniques did. I'd like for you to hear from this woman. I really could kick myself for not videotaping her when she first came in, because she was barely able to stand. She was leaning against the wall with her head up against the wall, muttering, and you couldn't understand one word she said. And then we worked on her, and this is like 5 minutes later. Right after we worked on her, this is what she had to say, and I think you're going to be really impressed with her.
Thank you. My procedure today has changed significantly, because before I could not even talk or sit or stand up for a long duration of time. So it's made a huge difference in the way I feel and look, even in my face and in my eyes. I hope that will help others to understand that this is very important, and they need to always have this done to stay feeling great.
How many procedures have you had done on your neck?
I have had about 5 neck surgeries, cervical, 5 neck cervical, C2 to C7, and I've had about 20 procedures on my shoulder, and I've had about 6 epidurals in my neck. Ablations, so total about 20. That's with the epidurals and the ultrasound ablations in my suprascapular blocks in my shoulder. It's a lot.
That's a lot.
Yes.
Well, if you think about that, you've got to have some. Now, in the beginning, when she came in, of the other patients you saw that couldn't speak and had problems, she was worse, just a few minutes before this. And And she was like 3/4 out of pain with her upper back and shoulders where she'd had all the injections. And the poor baby, can you imagine having 5 next to her? They did a full cervical fusion, and then it broke or didn't work, and they went and took it out and put another one back in. I can't even imagine having 5 neck surgeries. And I call her periodically and check on her and see how she's doing, and so I'm happy with her progress. So let's talk a little bit about surgeries, especially with her, because of what happened with her. We did a study with 74 patients with surgeries, who had had surgeries. Now, here's the way this went down. I'd had so many people coming in that say, oh, I had the surgery, and that's what started my fibromyalgia or my CRPS. I had a surgery, and I got worse instead of better. Well, what happened is that I just kept hearing this over and over, and I said, well, let's just do a study. So we did a 74-person study. Out of 74 people, and these were people with fibromyalgia, because this is mostly what I was treating at the time. And so 52 out of 72 had had surgeries to help something that was hurting them while they had the fibromyalgia. That's a pretty big number. 29 of the 52 got worse. 29. So you think about that. That's 65%, over 65% of the people that were trying to get help from their pain with a surgery, and they got worse instead of better. How frustrating is that? Plus their fibromyalgia gets worse along with it. We had 2 that got better. We had 3 that had multiple surgeries that had mixed results, and the rest had no change. So your chances of getting better, if you've got fibromyalgia and you're going to have a surgery to get better with something, your chances of getting better are somewhere around less than 5%, according to this study. So this is something that's really very valuable. It's very powerful. It's something that all physicians and all people that take care of people should know, because when they come in and say, oh, yeah, I want to see you, but I'm going to have this surgery first, they're going to come back after the surgery most likely worse than they were before. I had one patient who had 6 carpal tunnel surgeries. And if those out here are listening who are physicians, you know that in a carpal tunnel surgery, you cut the carpal tunnel ligament. How can you cut it 2 more times in each hand? I mean, that's crazy. And they just got worse instead of better. And this is the reason why. Why is this? A lot of people say, why are we going to pick on the surgeons? No, we're not going to pick on the surgeons. They dedicated their lives to getting people well. I have a lot of friends that are surgeons, and they really deeply care. I have one orthopedic surgeon friend of mine. He said, something goes wrong. He said, I lay awake, can't sleep. I'm wondering what I can do better. How can we change this? How can we help these patients? And that's what's really going on with these surgeons. But what's missed is that when you go to sleep at night, your neck oftentimes gets uncomfortable, or your shoulder, and you roll over the other side and you move, and it gets better, and you move at night. Everybody does. This is what people do when they sleep. And even with that, you still have muscle tension and muscle turgor. I mean, you've got not turgor, but you have the muscles are actually functioning well and helping things to be in the right position while you're sleeping. Anyway, I didn't say that properly, but you get the idea. So when you're in surgery, you are on your back. Oftentimes they'll, with good intent, put something underneath your neck to help support it. And you lie there many times for hours while they're doing a surgery, completely flaccid, and oftentimes those structures will slip. They'll slip forward, and you'll come out of it with a compression on the meninges. It's not every time. I don't even have a stat on how often. I have no way of doing that because I'm not in that arena. But I know that it happens enough that I see the results of it, from the people that I've taken care of. So right now we've got tens of thousands of people getting well from all of the people who are working with this. And we do have the new protocols that I'm so excited about. The new protocols, I can teach anybody to do this, and it's no more than using pressure techniques, which is legal in every state, as far as I know. And I think that And not only that, but if you have a loved one that's sick, you can come and take our training, go home and get your loved one well rather than dragging them out sick and having to stay in hotels for months. So really happy about what's going on with all this. The main thing that this works, here's the main things that these work well with. Fibromyalgia, trigeminal neuralgia, CRPS, chronic back pain, and most of your neuropathies. Now, it does work on other things, too. I had a guy come in at a training. I was in Florida at a training, not a training, but at a seminar I was putting on for sick people, and we tested all of them afterwards. At 11 o'clock at night, we had a lot of people show up and still testing, and the last guy comes in, he goes, I said, what can I do for you? He said, I have pain in my big toe. And I very rudely, without thinking, chuckled. And he goes, no, I'm dead serious. He said, my toe is killing me. He said, I'm thinking about cutting it off. It hurts so badly. He said, I've been everywhere and nobody can help me with it. And I said, well, I don't know that I can help you either, but let's work on you and see. And so I worked on him for about 5 minutes and his big toe pain went. His big toe pain, the neck was cycling, the meninges was cycling this pain in his toe and keeping it active day and night and just driving him absolutely crazy. If he would have cut it off, it would have hurt just as bad, if not worse. And so that's what we're finding. We're finding a lot of people with phantom limb pain, their pain goes away because it's just pain that's being cycled by the meninges. We're seeing the same thing taking place there. Now, things that we're having good results with that I don't have enough to be too strong about, seizures. I'm going to show you a little bit here. I've got a girl I'm going to show you who had a grand mal seizure at one of our trainings, and we stopped it right on the spot, and I'll show you that in a little bit. But a lot of the patients who are coming in with these diseases, or these conditions, I should say, also have seizures. Now, so far, of the ones that came in and had seizures also, 100% of the seizures went away because we were able to, when we made the correction, the seizures disappeared also. Now, does that mean I can get rid of all seizures? No. But I'd sure like to try. I don't know which ones I can and which ones I can't get rid of. But I'll bet you anything that a lot of the epileptics would respond to this, but I haven't had the opportunity, so I can't say much about that. Depression, oh my goodness, this is almost every single person who has this has depression. Blindness, there's another thing. I'd like to work on people that have idiopathic blindness, because if you don't have an eyeball, or you don't have an optic nerve, or you've got a tumor in there, we're not going to change that. And I would be stupid to say we could. But for the people that just all of a sudden they can't see, then usually they'll have other symptoms of the fibromyalgia or something along with it. Sometimes we help those people, and they get their sight back. I've seen it happen. Tinnitus, a lot of people call it tinnitus. It's the ringing in your ears. About 1 out of every 5 people we work on, that goes away. The rest of them, it's just us old people who didn't have ear protection when we were young, who were shooting shotguns and using skill saws and hammering and all the things that we did. And there's just a lot of things. But anybody with any chronic pain, we test them. The test is free. It's like, and if it works, it works. We know they can get well in almost every case, and then we help them. So I'm asking you guys to shoulder up with me, learn my techniques, and help other people, because we really need it. And for those of you who are suffering from your business burnout, this is a great time to change professions. It's a real inflation beater right now, because inflation is sucking up, your income, and this is a great way to be able to make a good income for your family while you're doing something great like getting people well. What could be better than to do this or be the pastor of a church and help people and get paid for it too? Come on, this is a wonderful opportunity. This is a woman that took my training. I really like her. She's so sweet.
Hello, my name is Neda Desla. I'm here with Dr. Paul. I just completed a training with him, and I have to say it was amazing. We had many people come in. Every single person left with less pain. Some of them left with no pain. So I think this training is amazing. I recommend it to anyone who wants to do it. Please.
We're a sweetheart. These are all longer, but I cut them short just for the sake of brevity, so that that I don't tie you up. And this guy here is really interested. He'd been under treatment for somewhere around 17 years with a medical doctor in a holistic clinic, a very large holistic clinic back in Atlanta, and the medical doctor there, who took the training, and his staff also, asked him to come in because he was one of their more difficult cases, and here's what happened.
I walked in, I'd say I was a 7, lower back discomfort, and it's alleviated completely. Feel very, very relaxed in my midsection, and I have not been relaxed in the last 15 years. I felt during the treatment this sort of anxiety just kind of release through my chest and ease down towards my feet, and it's gone for the first time in, I'd say, 15 to 20 years. So fantastic treatment. I highly recommend it, and it's a wonderful opportunity. If you have it, take it.
Great guy. So again, what causes this? It's actually caused by a constriction on your spinal cord structures that moves the covering of the spinal cord out of its normal position, and it doesn't stretch, so it can pull on widespread nerves all the way down your whole back, and that's why patients with this can come in with full body pain, or they can come in with isolated pain like your CRPS. And now let's mention something else. Let's talk a little bit about trigeminal neuralgia. A lot of people come in with facial pain. I always remember this one woman. She came in from England, and she would just sit, and she wanted to hold her face, but she couldn't touch her face because she would get lancing pains if you touched her face, if the wind blew on her face. It was just unbearable. I'll tell you how unbearable it was. She had pulled half of the teeth in her mouth already because the pain was so bad. And you know what happened after she pulled her teeth? The pain got worse because it aggravated the neck while they were doing it and created a worse problem. And so when we took the compression away, the pain went away. And so we've seen this. I saw another dentist in Texas, and she'd pulled half of her teeth, also had them pulled because she was in so much pain. And she responded, and the pain went away with our test also. So anybody, so who do we test? Anybody in chronic pain. And there's so much more to be learned, and I need people out there who are like-minded, who are working on people, who are getting hands deep in this and figuring out what's going on and making some new breakthroughs in other conditions too, because we don't know how deep this rabbit hole goes. We don't know all the things that it can affect. Weird things. How about I had a patient from Reno that came in. He was 18 years old, or 17, and he knew how many tiles were in every room of his school. When he was driving, he would count the lines on the road. I mean, that's dangerous enough. I mean, he was so OCD that everything had to be perfect, everything had to be counted, and he came in with a diagnosis of fibromyalgia. When we took care of that and that went away, his OCD went away. Now, what is that? How in the world? So this is so powerful, and it affects the brain and the way it functions so drastically that it can create an inability to speak, to see, to smell, to taste. I've seen all of these things, and they come back many times. These things will come back with the care that they're received, and that's why I'm so excited about what we're doing, and I'm even more excited about the fact that we're able now to train people that are not physicians who can do this work and get people well with pressure work, which is really, really absolutely crazy. There's some other techniques that are taught to massage therapists. I probably shouldn't bring up their names, that you would know them, that are being taught that are actually more invasive than what we're doing, and this works like 20 times better. And so I'm pretty excited about that. And again, I'll mention, because it's been a while, that I'll just call him Dr. Michael, the neurosurgeon. He found the same thing I did and was cutting the back of the vertebrae off to release that pressure and keep people well. He should be like, He should have got a Nobel Peace Prize for his work. I mean, this is big stuff. This is big stuff we're doing. And again, if you look at the brain and the spinal cord, you can see that, if you can look at a cross-section of that, you can see how the brain turns into the spinal cord and comes out and gets distributed all through the body. So if you've got this big electrical cord that comes into a town of millions, not electrical, let's say it's a phone company cord, maybe it's fiber optics, as it goes through the city, it divides those fiber optics off into homes everywhere, and by the end of it, when it gets to the end, it's gone. There is no more cord because it's all been divided up, and that's the way the brain gets distributed to the body. We also have some really interesting things that are taking place in the brain and in the spinal cord, and we have found that every time you think a thought, every time you do a new activity, whether it's golf or whatever it is, that your brain and your spinal cord, even at the spinal cord level, you grow new nerves to help you accomplish it. That's why they say you don't want to learn something the wrong way, because you've now developed nerve fibers to help you do it the wrong way. You learn it right the first time, and you've developed only good nerve fibers to help you do it the correct way. And so those things can create cycles. I think part of that can be some of the reason why we're cycling these pain symptoms that we can break by alleviating the meninges. And again, the meninges come off the spinal nerve roots that come off of the spinal cord go through the meninges. The meninges pulls on them, and that's what causes the nerves to fire inadvertently, and you end up with all of these symptoms. So what do the symptoms look like? Here's a good list of them: insomnia, fatigue, emotional instability, depression, irritability and nervousness, anxiousness or anxiety, mild to severe body pain, headaches, difficulty breathing, irritable bowel syndrome, panic attacks, trigeminal neuralgia, calcium deposits under the skin, communication problems, rashes, rectal spasms, vaginal pain, severe low back and hip pain, forgetfulness, and foggy mindedness. Now, I didn't mention earlier and I should have, is that if you pull in enough nerve roots, it overwhelms the brain and not only puts you in sympathetic, but if you were a computer, this is a good explanation, it uses up your RAM. RAM is random access memory, and it's what your computer uses when you're putting information in. It distributes everything. But when you have a brain and you send too many impulses to it, it can't process all those impulses at once, and so you get what we call foggy mindedness. Foggy mindedness is, I'll give you a really good example. I had this dear woman come in. She was like 35. And you just had to fall in love with her. She was just so sweet. But she didn't speak hardly at all. She'd sit and stare at the wall all the time. Most of her sweetness came out later. I'll tell you about that. But she would just sit and stare and just blank. And you'd ask her a question, and she'd answer you in a monotone. And she could speak, but she didn't have anything behind it. There was no emotion. There was no personality. About 2 weeks into care, and this is when we were using manipulation, otherwise it would have happened faster. I walk in the room and she goes, "Hello, lovey." And I go, "You're back." And she goes, "Yeah, I'm back." And then we had the conversation of how much better she was, and her personality came back, and she was able to think and function again. But they call this fibrofog. I don't know who coined that, but probably the fibromyalgia sufferers. But that's what happens when you have too many impulses hitting the brain because of the meningeal compression. And so all these other things can happen, including the insomnia. We talked about insomnia because your sympathetic nervous system's running. You have insomnia. You have a fatigue because you don't sleep. You're emotionally unstable because, you've got impulses coming from all over your body. You can't even think straight. How could you be stable at all? Depression, irritability, and so forth. And the anxiety because you're in sympathetic all the time. So this is wonderful. Now, it affects four main things. It affects your cognition. So the things we talked about, like nervousness, depression, fatigue, insomnia, anxiety, it affects your motor skills. Now, if it gets bad enough, you end up in a wheelchair. And I've had many people in wheelchairs. I called up one of the doctors I trained. He's just a great guy. I met him in Dallas and at a promotion we were doing. And we're actually doing seminars for doctors to show them what we could do. And he says, he came to me privately and he says, my wife has breast pain. He said, nothing else, only breast pain. She can't touch him. I can't touch him. She can't wear a bra. She said, she's in horrible pain all the time. Can you do something to help me? And I said, I have no idea. I've never seen anything like this before. So he brought her over. She was there at the training or at the presentation. And I worked on her and her breast pain went away. And he goes, I'm in. I'm a solid. I'm in. And I'm going to take your next training. And he did. And he went home, took care of his wife. And his practice literally went from, he was seeing about 75 patients a week. And 2 months later, he's seeing 235 patients a week. It just went nuts. And I said, how in the world did your practice grow so fast? He said, I just went home and told everybody about what this does and what happens. And everybody just started coming in. And he said, I was so busy. Motor skills. If it gets strong enough, and the reason I brought him up is when I called him back the other day, or called him the other day and we were talking, he said, we had this thing in my office that when people came in wheelchairs, that is kind of like, you throw your drugs in a drawer, in a big jar on the way out. I don't think that's a good idea because leave all those around, but he said people would leave their wheelchairs. He said, I had like 25 wheelchairs at my office of people that came in wheelchairs and went out without them. And that's what this stuff does. Your motor skills get affected to the point where it easily puts you in a wheelchair. Yesterday, I had an old patient call me. She actually had become a dear friend, and she'd been in a wheelchair for 14 years. 14 years in a wheelchair, and she had a buddy with her, and both of them had been in wheelchairs, and they were so sick. She said, I was so sick that I couldn't figure out where the forks and the spoons went. And so she came in, and we had to lay her down because she couldn't sit up. And anyway, we worked on her. She got like 100% well and went home, and she ended up traveling around doing seminars with me and telling her experience. And her girlfriend came in before she did, and she got well and went home well also. And so this is the kind of thing you're going to be doing if you learn this training. Or if you happen to be in a wheelchair, you need to get somebody who does know this or get a loved one to learn it. So your motor skills get affected drastically. Your sensory, this is why you have pain. This is why you have the numbness, tingling. You have the paresthesias, the trigeminal neuralgia. That's all the sensory. And the behavior, I mean, come on. How in the world are you going to behave if you can't function, you can't think, you can't get anything done? You're exhausted all the time, and you're on heavy medications. I mean, just because you're sick and taking medication doesn't mean medications don't have some pretty bad side effects too. So I want to talk about something new now. This, I think, is one of the most important things about relationships. Are one of the things that gets impacted the most when a person is really sick. And we use an example of, it could apply to anyone in chronic pain, but especially with people with, let's say, fibromyalgia. So let's say you're the person that has fibromyalgia, and you wake up in the morning, and the first thing you do is you reach over and you grab you're having anxiety because you didn't take your pills in the night, so you take your Benzodiazepine, your Xanax, or whatever it happens to be, and then you're in pain, so now you're reaching over and you're getting your Dilaudid or your morphine or your fentanyl patches, something to help with the pain because the pain is just so horrible. And then, of course, you're depressed, so maybe you're taking an antidepressant too. By the way, people who are sick like this, if you're taking 4 medications, you have a 50% chance that those medications are working against each other and creating reactions. If you're taking 8, there's a 100% chance. Just something to know. So now this patient, or this spouse, wakes up and they're taking the medication, and let's say you're the well person, and you see them doing this, I mean, your heart breaks. I mean, if you love them, your heart breaks. And you remember the time when you guys used to go on vacation and you rode bikes together and went horseback riding or scuba diving, whatever you did, you know, and you had fun together and made love together and those things. And you just see them looking so bad and feeling so bad. And you spent the family fortune already taking them from place to place. Nobody can help. All they want to do is medicate. And the medications oftentimes create problems. I know Lyrica is a medication that I've seen in the office that a lot of patients complained about. I put on 50 pounds taking this, and I had these horrible reactions to it. And then some of them say that I took it and it really helped me. You know, but the medications have their own set of side effects too. So now all of a sudden you've got a spouse that you know, let's go back to you're the sick one. Excuse me for getting sidetracked there a little bit. So you're the sick person, and now you get up and take your medicine, and you just go back to bed. You just stay in bed because you're so exhausted from a miserable night of not really getting to REM sleep or maybe not sleeping at all. Maybe you get up at 10 or 12 o'clock. You get on your computer, maybe look to see if there's any new breakthroughs for getting well. And your nervous system is cranked up so hard that you are just burning through it's like your spouse comes home from work and you're 10 times more tired than they are, and you stayed home on the couch all day. And they don't understand why you didn't do anything all day, and you're like so tired. And some people, some of the spouses are not nice about it. They're cruel about it. Even the kids will say, "Oh yeah, Mom, she's a hypochondriac," or "Oh, Dad, he's just lazy. He doesn't work anymore." That kind of stuff, and it's horrible when they do that because it's really downright mean. But oftentimes they just don't get what you're going through. And so if you're the person that's suffering and your anxiety is so bad and your depression is so bad and the suicidal thoughts come in, and on your worst days you wish you could just commit suicide. Now, for the spouse, you've lost your buddy. You are now a caregiver at whatever level, whether you can still work and take care of them, or whether you have to stay home and take care of them full time. You're a caregiver. You're not really as much a spouse as you are a caregiver. I shouldn't say that because you're a spouse. You love them. They love you. But they're sick. And they're sick at levels that people don't understand. And people will say, well, you don't look sick. You don't look like you're in pain, but you are in pain. Even the doctors will oftentimes look at you and go, are they just trying to get drugs? And you can't really blame the doctors for that because they're getting their license pulled for giving too much drugs right now. So that goes on and on. Now, a good part of your relationship is communication. And when you're too tired to talk, that gets killed. It's doing things together. That part dies off. It's having sex. Can you imagine if you've lost your testosterone, and this is what happens to almost all the people when who are sick, especially with fibromyalgia. I used to send my patients over to a friend of mine. He had a lab. He was an OBGYN, and he called me one day and said, Paul, do you realize that your patients don't have any testosterone? He said, I've never seen anything like this in my life. And that's because you don't need that in sympathetic. That system shuts down. Also, vaginal pain is one of the cardinal signs or symptoms of dealing with meningeal compression. And if you don't have any desire at all, your libido's gone, and you've got vaginal pain, why in the world would you want to have sex? Other than the fact you just want to make your spouse happy. And then your spouse is sitting here going, I'm hurting her. That's not any fun. Who wants to hurt somebody with sex? And so those things in your relationship die back, and they get hurt so badly because you're not married to the same person anymore, and they actually have a personality change oftentimes too. So that's what's going on. So when we are able to take that pressure off of the meninges and let everything flow again, the sympathetic turns off. They sleep again. Their irritable bowel goes away and they can eat again. Their libido returns and they want to have sex again. Their testosterone comes back. Their blood pressure goes back to normal. I had a patient call me one time and he goes, I went home and my blood pressure got so low my doctor had to take me off my blood pressure medication. It's because oftentimes it goes up when you're in sympathetic. That's a normal response. So all of these things that we've looked at with, I wonder why that's happening, for all these years, we've got really good explanations for them now. And also good explanations why if you study, like if you start looking at the research on fibromyalgia, they have high rates of cancer, they have high rates of just about everything, because the whole body is just not working right. And that's what we're seeing with relationships. And when it's over, we see happy couples again. I have one guy, he goes, my wife's a little frisky now. He came in from England also. Both of them they were scientists. And he goes, my wife's a little frisky now. And they were taking off on a trip. And then, anyway, it really does make my heart well. I had a guy come in, he goes, I'd have given you $100,000 to get my wife back. He said, my wife's well. He said, I got my partner back again. That's what happens in relationships. Now, what we've covered so far, and if we've covered how this meningeal compression can create fibromyalgia, how it can create CRPS, how it creates trigeminal neuralgia, and all of them respond just as easy. You know, some of them that come in, they're just scary because they're in so much pain. They get well too. The people in wheelchairs, I've never had a person who was sick, who was in a wheelchair because she had fibromyalgia. I never had anybody come in who was sick that had fibromyalgia or trigeminal neuralgia that was in a wheelchair that didn't get out of the wheelchair. They all did. Does that mean it'll be that way for everybody? No, but it seems to be that way. That seems to be the standard. So if you're really sick and you've been diagnosed with these things, or especially fibromyalgia, you're probably not going to be in the wheelchair. You're going to be up and walking again. Now, my standard in my office was within 2 months you had to be walking 3 or 4 miles a day, even if you came in a wheelchair. And they did it. And they did it. And that's a huge testament to what we're doing. So it works well for your neuropathies, your back pain, your sciatica. Now, if you get in with a knee that has no cartilage, some of those get a lot better, but some of them don't, because the cartilage is not there. It's bone on bone. It's going to hurt. You got a blown disc that's sitting on a nerve. I might make it a little bit better, but I'm probably not going to fix it. But it's worth getting tested, because oftentimes the diagnosis is not accurate, and we can help you. And so these are the things that we're working on any chronic pain. Come and get tested, and once you get tested, you know whether you can get well or not. And that's what we're doing. And if you're a practitioner, please, please, if you're even interested in becoming a practitioner, whether you're a massage therapist or a neurosurgeon, we're training everybody. I've got a neurosurgeon. He said, I have no idea how many surgeries I did on people that had this instead. That he said, I'm sure I did a lot of surgeries that were unnecessary. And so everybody needs to know this. And if you're an MD and you got people that walk into your office that say, I'm in pain, and you look at them and you wonder, are you just a drug addict? Or are you really in pain? So you run a test and you say there's drugs in their system, but why wouldn't there be drugs in their system if they're in pain? Or if you're an alcoholic, I just wonder how many people in AA are drinking because they're in pain, and we get rid of their pain. It's a whole lot easier to get off alcohol when you're not in pain anymore. It's a whole lot easier to get off your drugs. What if your doctor takes you off your drugs, which a lot of them are doing today, and you really need them? But you know somebody down the street that sells drugs, so you go down there and buy drugs from them. I mean, now all of a sudden you're a drug addict, you're not a patient anymore. At least that's the way you get labeled. There's so many people that need to be helped. What if you're sick enough? What if you're so ill, like some of the people you've seen here, that they can't even speak or function, and nobody's taking care of them? They end up on the street, and they're too sick to take care of themselves other than going through a trash can. I mean, come on. And wouldn't they take drugs if they can figure out a way to get enough money to do it? I think a lot of the people who are homeless are not just homeless people. They're sick people that need our help. Please come take the training, shoulder to shoulder up with us. We'll all work together. Let's get some people well. Let's get some studies done on people who are living in the streets, and what percentage of those we can get well. I'll bet the government would be really happy to see these people get well, for one reason, just to see them get well. The other reason, they got a taxpayer back. Anyway, love talking with you. Thank you very much. I'm going to end this segment right now. Thank you so much for listening.
If you're ready to explore real solutions and finally put an end to chronic pain, visit the Chronic Pain Academy and discover the options that could change your life. Don't forget to subscribe so you never miss an episode. Your journey to lasting relief starts here.